Okay, good morning, everyone. So this is actually I'm very enthusiastic right now, right off the bat. As you heard yesterday, those of you who were here, do we have any new people who weren't here yesterday? 1, 2, that's great. 3, 4, 5, okay. Great, well, welcome to day 2 of this very important workshop. And again, just to make sure you're in the right room, and if I see all 5 of you walk out, it is building a national capability to monitor and assess medical countermeasure use in response to public health emergencies. So welcome to day 2. For those who weren't here yesterday, I'll go through sort of a litany of how we ran things yesterday, but I do want to start off with a quote. And that quote is actually from Justin. Where's Justin? Justin, you here? Okay, there you are. Okay, yeah. But he actually said something good. Remember how we finished yesterday? Those who weren't here yesterday was that whole sense of complexity, right? And so Justin this morning, actually, and Justin, as you were speaking, you noticed that for a second there I wasn't attentive and I was writing something down. You probably noticed and thought, how rude of that man. We're in conversation. But what he said was, his analysis of yesterday was, we went wide yesterday. And then what we allowed you to do, and I love this term, I'm actually going to steal it for future events, is we'll allow us all to marinate in the complexity. Now, another famous person recently said is this healthcare stuff is complex, right? And now, to paraphrase that person, this medical countermeasure monitoring and assessing thing is complex. And I kind of want to start out our day with, yes, acknowledge the complexity. But like many other workshops we've been in, today's the do-it day, right? Today's the day, as I mentioned yesterday, that we kind of have to walk away saying, okay, was this a complete waste of time? Or did we progress? Do we meet Perrin's objectives, which is he wants to feel good today, going home. And knowing Perrin just out of this workshop group and getting to know him these next 24 hours, I don't want to disappoint him, right? He's a surgeon by training or not, right? The surgeon mentality, I've been to med school, the surgeons throw things, they're very, they have life and death in their hands, and I don't want to see a pissed off surgeon, upset surgeon. But, frivolity aside, today really is the do-it day. And so let's have past that aspect of marinating in our complexity, to quote a wise man, and move on to today's program. So again, I thank you all, to the attendees who are here, to the new people who come in midstream. You will catch up and maybe not be, I hope, as frustrated as maybe some of us were yesterday with the complexity. Want to acknowledge the planning committee. Once again, planning committee, raise your hand, because this was not all doable without your input over multiple phone calls over the last few months. The project director, Justin Snare, and board director, Andy Pope. Not sure if Andy came back today. And other staff, Alexa is out there. Alexa, it's a really hard time to have a name Alexa, isn't it? Yeah, but on the other hand, I think of you like 10 times a day. I do, because I go, Alexa, turn on the bedroom light. And I'm thinking to myself, I know someone who probably, Alexa, can you do something? Oh. But no, it is a difficult time, I realize, but beautiful name. So Alexa and others within the Academy, and of course our facilitator who's been doing yeoman's work, Laura Reynolds. Laura, well done. And we're expecting a lot from you today as well. The other part of the crew that we never acknowledge at moments like this, and I spoke to them briefly, is our audio-visual team. Hello out there behind the camera. It's great having people in the background, and you only need them when a crisis comes up. But on the other hand, they're always there, and I always try to signify the importance of their work in terms of documenting. Workshop objectives, I'm going to go just briefly through them so we remind ourselves, this isn't, oh no, he's at it again. It's really a refresher for day 2. So let's remind ourselves, right? We're talking about discussing the roles and efforts of the federal government, relevant stakeholders who have an interest in building and maintaining a national medical countermeasure monitoring and assessment capability for public health emergencies. So that's the theme. We're here to discuss federal monitoring and assessment efforts, opportunities for future work in areas such as electronic health record capabilities, big data, clinical networks, and operations for response. And with yesterday's discussions, we actually expanded some of those definitions. We're also here to help inform the development of strategic medical countermeasure monitoring and assessment plans for public health emergencies. As mentioned yesterday, this is an interactive scenario, right? So we do want your input. Do not be afraid to speak out. The bios today will not be read. They are available to you. We have a lot of really good people on board today. As we have the last series of panel discussions, we ask you to hold your questions until we open it up to the audience. So we'll have panels speaking with each other on stage. During the facilitated discussions, you are encouraged to respond to questions. Always identify yourself, just for the record. Workshop proceedings, which is reasonably accurate and objective summary of what occurred, will be authored by a rapporteur with the assistance of Academy staff. So that's what we're coming up with, is a proceedings, not a report, not anything else beyond that. We also avoid the term, I'll use it, but from the Academy's perspective, we don't use the term that we're coming up with recommendations. Recommendations has a certain, a connotation that comes from it. We're basically, I like the word that we're going to be using a lot, I hope, today, which is we're coming up with solutions. The workshop is audio and video recorded, so no swearing. Breakout conference rooms, lunch rooms, bathrooms, and emergency exits are located on a map that has been given to you in your packet. Our engagement methods, as yesterday, will continue today. We'll have some panel interviews and discussions. There's a reflection wall out there. So if you have any reflections, anything you want to post, please do so. And my expectations are, again, lively discussion, right? This isn't the type of workshop, as I warned everyone yesterday, that it's just sort of you're being talked at, right? This isn't PowerPoint, this is discussion. We want you to view your world from this world from your perspective, listen to other people's perspectives, and at the same time, get your opinions out there. So what happened yesterday? I received 10 pages of notes yesterday, which I analyzed on the Metro coming in this morning. And actually it was kind of fun, because those of you who were here yesterday know I missed part of the day, my daughter's graduation commencement speech on my behalf, and it was really fun. But I think what I got out of the 10 pages of notes was, in essence, is yesterday we viewed the world from all these different angles, and as I mentioned, got into some of the complexity of the moment. And yet what we're trying to do today, and specifically we'll be switching gears a little bit in the afternoon session, is we're going to break into smaller groups, and the idea is that's where the rubber hits the road, right? That's where we view this idea of solutions from all these different aspects. And it was interesting, looking at these 10 pages of notes, the theme that I got yesterday goes back to the quote of the president, this is complex, this is hard stuff. And there's not one perfect answer, right? When we look at EHRs as an example, they're out there, they're doing something, they're perhaps under development. But the question is, when we look at data, and Eva, you had some great quotes yesterday in there that was attributed to you. So Eva, it's great having your mind in this, as everybody's mind is involved in all this. But to a large extent, there's no perfect answer in any of these things, right? Big data exists, and yet how do we sort of take that big data and grab what we want? The idea of connectivity with the end user, right, with the medical countermeasure user. Well, we perhaps are getting into this idea of the technology available, right? We have the phones, we have the ability, but does it ever reach that level of robustness that's necessary in a real clinical trial? And the bigger question is, what kind of data is de minimis, right? What do we really need in the midst of the emergency to be able to provide public health emergency decision makers to move ahead? So to some extent, we're in a quandary, right? Because after yesterday, it's not out there right now, what we're looking for. It's not. But how do we take all these different attributes and start heading in that direction? That's the theme for today. Right? How do we start saying, okay, if it's not out there right now, and short of rebuilding, although rebuilding a brand new system is perhaps one of our solutions, but once again, we have to have that realism in there. Rich, something happens tomorrow, something happens a month from now, something happens a year from now. What can we have in place to begin to solve this issue? Monitoring and assessing. So, without further ado, we'll move on to our first panel. And I'll hand this back. Oh, you know what I'm doing? I forgot. That was our plan for the day. What I'm going to ask you to do what we did yesterday just to get us into this idea of a healthy beginning to our day. And as I mentioned yesterday, or I might have, I think I certainly mentioned it at the commencement speech in front of 125 young women stepping out into the world when I wore my Surgeon General's cap. I mentioned two things, one of which is healthy decisions in one's life. Beware, and this is being the acting Surgeon General hat, beware of anything that has the Surgeon General's warning label on it. But not everything in life is labeled. But my quote for that section was the World Health Organization definition of health, which is complete physical, mental, and social well-being. So in order for us to start off this session with health in mind, let's all get up and just stretch for a second. That's the physical part of it. Right? We've not been sitting for a long time, but it's always good to stretch, get those muscles moving. And the social aspects is turn to your neighbors and say hello, good morning. You want a handshake, a fist bump? Okay. And part of the physical endeavor, once that's done, we're going to ask the panelists to start walking up to the front. So panelists, start making your way to the front. And after you have we have the panelists up at the front, I'll ask everyone to sit down yet again. Okay, 10-second warning. 5-second warning, and we'll ask everyone to sit down again because we'll go through our last exercise of health. So everyone sit down, close your eyes for a second. Big deep breath in, big deep breath out. Breathe. Big deep breath. Fill up those lungs and out. Get yourself into a happy place. Think about what goes on today as an advancement for the good of public health and for the good of our nation's safety and security. So what we've done here is the physical, the mental, and the social well-being. So we've started out at the National Academy of Science, at the Medicine, with an exercise of health. And now, ladies and gentlemen, without further ado, Laura Reynolds.